Famang hanifen tuaja am giri roli sol man muka hanifen tualeja albeni la ya dualeja se jaburja ndul ka bifle de mo space te bualeja duol bela dua du bual be bua alla bolon esti Gambian dream brikama boyo ndul kanna kuole ke is all about Gambian talent TV. Tune in direct ala jibe, stay tuned. Mimbe kiring Gambia Bantala Gambia Luo
together to rebuild for the future. We cannot keep on brooding over what happened or what didn't happen in the past. This is an opportunity for us to build a new Gambia, and the health sector is a very important sector when it comes to nation building, because without a healthy people, certainly you forget about the agriculture, forget about every other thing. People need to be healthy first before we can get to those places. Sure. That becomes difficult if we do not have the right people to provide those services. You can have the best of equipment. If you don't have the right people, when it comes to capacity, their know-how, when it comes to the mindset, then equipment becomes useless. So we are very happy that we are going to build capacity with the help of the Red Cross and Soul Health, the partner, very important partner, to build capacity of our people in the communities. The training of community health nurses is very, very important. Most of the times, why we have a lot of challenges is because patients present to us very late in the health facilities. Breast cancer, for example, presents very late in most of in fact, in advanced stage. Why? Because nobody was trained enough to detect it early enough for curative care to be given. Those lives might have been saved if we had competent people in the communities. Even other childhood illnesses, they get to the hospitals late because they were not diagnosed early. No one picked them up. So training those people in the communities is very, very important, and the effect will be felt not just in the communities but at the secondary and even tertiary levels. So we are very excited today, and we assure you that the funds will be put to very, very good use. Now in Gambia, I must tell you, especially in the Ministry of Health, there is accountability and good governance. We have a struggle. It's not easy to change the old habits of the past, but Honorable knows, he bears us witness. Every day we are up and about to make sure that there is a difference, that we build institutions that are there for the people of this country. Once again, thank you very much.
Thank you.
Thank you. Thank you. We appreciate it. We appreciate it. Thank you so much. Yeah. As always. Honorable.
Well, we are here as a federation to which the Gambian Red Cross is a member. And that is one member among 192 in 192 countries. And the mission is a very simple one. It is to provide humanitarian assistance to people in need, and that on all time. Another particularity is the fact that, those national societies, they count on volunteers that are in every corner of every country, almost I would say in every village. In order to be able to continuously provide that support at a scale and magnitude that will be matching the scale and magnitude of the needs, we negotiated with the government a status agreement that will facilitate the establishments of the federation here in the Gambia to be faster, to act quicker, and with better quality to alleviate human suffering and to save lives wherever we can. And we are very pleased, to see the Gambian government responding to that and creating the enabling environment, and that on that note, we reiterate also our commitment to work on their side.
Yeah, we understand the Federation has sponsored community health nursing students. How committed is the Federation in the near future in sponsoring more students?
Well, you see, a humanitarian response is a journey, and that journey will never stop. As long as we are united where we all belong to, and that is the one humanity we all share. There will always be people in need, and among those needs we account health is key, and nurses, particularly at the community level, are extremely important, and that has to be renewed. It is a long-term partnership that we're engaging in together with other partners, and that will not stop in one check, it will not stop in one training, but it is a continuous program which we hope will be leading to more success and more opportunities for other community health nurses to be benefiting from.
The signature is done. Alassane Senghor, my Secretary General. Ladies and gentlemen, this is an important occasion for the Gambia Red Cross Society. this is an important avenue as well to express our sincere thank you to all of you who are present. But more so, I think I will thank Alaji Asi as last. Before UNDP leave, we want to thank the UN system. The Gambia Red Cross Society is implementing a lot of projects. And we hope we will continue with the fruitful cooperation we have with the UN system. With the UNDP, we are implementing the livelihood activities, and we hope that will continue. UNDP, before we leave, we will still knock at your door for more collaborations and for better collaborations. So we thank you very much and we appreciate your work. The Gambia Red Cross Society is collaborating with the government in a lot of avenues, but assisted by the UN system. With the UNICEF, with WFP, with FAO, and with others. I don't want to be biased. WHO, World Health Organization, and we hope, because the present Secretary General has a lot of programs, is undertaking a reform, is undertaking revamping of the society. So we hope you will join us. We want to thank the UB1 and the Soul Health for the health project we have. And we want to thank the Gambia government. The Gambia government has created a very good environment for our work. The environment that we are actually utilizing to ensure that the Gambian people, the people who are in need, get the real assistance they need. A lot of people consider Red Cross to be emergencies and so on. Red Cross is more than that. Red Cross builds capacities. Red Cross helps the needy, the resilient population who are out there, who needs more livelihood to augment their livelihood, water, sanitation in a lot of areas. So we thank all those who are joining the Gambia Red Cross Society. And we thank the Kenyan Society. South-South cooperation has yielded a very fruitful cooperation, very good results in the Gambia. A very fruitful result. The Kenya Red Cross and the Gambia Red Cross is collaborating to ensure that the sick, the wounded people, emergencies are at the core of the society, programs of the society. The core programs in the sense that they have bring a state-of-the-art environment, ambulance, state-of-the-art medical services, together with the Gambia Red Cross Society. We hope the Gambian people will engulf this, will take this to be a good example of South-South cooperation. We invite everyone to join our emergency services. The Federation, before I thank us, we thank the Federation in Dakar for their assistance. The Secretary General has mentioned the impasse. Definitely, Senegal and Gambia, they are brothers. It's one country with two states, one people with two states. We thank Ambassador, His Excellency Ambassador Fode, for all your efforts to stay by the Gambia, with the Gambia through the difficult times, and still he is in the Gambia with us at the Senegalo-Gambia Permanent Secretariat. Usman Silla is my brother. I expect nothing less from him. This is a humanitarian organization. Thank you for your efforts, and we appreciate your push at the National Assembly. We are telling the Gambian people, Red Cross has the highest human resources in the country, and Red Cross is willing to go to the last door to help. Red Cross is willing, when it is hard, to come out through its volunteers. So all Gambians must really appreciate this and appreciate our volunteers. Therefore, we appreciate the National Assembly for your push. We still need more avenues with the programs that we are having. And finally, let me thank us. Alassane said just a little bit. When the going got tough with the National Society, we turned back to the Federation for help. And we thought of the Gambians that have experience with Red Cross, that have experience outside world, that have really committed themselves right from their youth age, whether how best they can assist us. And that's how we came to Alassane Senghor. Alassane got no choice because he knew his society was collapsing. So he got no choice. He can't let the Gambia Red Cross collapse over his dead body. That I know because I worked with him since 1977. And when we approached us, Mr. C, Alaji C, he really encouraged us. Personally, left to talk to Alassane and Enso and told us that he will ensure Alassane will come and save the society. Alassane has come. Now we are able to pay salaries. We are able to pay our part of our overheads and a lot more. And we are investing as well. We want to invest. We want to work. I have said a lot of things, but we appreciate all our collaborators. The UN system, we want to tell you that we are one of the partners you can rely on. I think WFP has attest to that with the money transfer that we have done with them throughout the difficult times, and as well as UNICEF with the children. They know how we are, and we want to show you that Red Cross has even better system in place, better structure, more experienced experts, more capacity in place, and we are still recruiting more capacities. We want to thank you, and we appreciate, and we want to welcome you to work with us We thank the President of the Gambia, who is the chief patron of the Gambia Red Cross Society. And luckily, today, we have witnessed that. And we thank him and all his cabinet members, Ministry of Foreign Affairs, who cannot be with us. He has been at our service throughout, whenever we need him. And we thank him, Tangara, Honorable Tangara, for his help, and also for his willingness to work with Red Cross. Finally, we thank all of you. Ndeye Aissatou Njai, a veteran, a Gambian veteran, the Honorable C, former Minister of Health, we thank you very much. He has been with us. He's dedicated to the cause of Red Cross. And Dr. Bitey, thank you very much. We want to welcome you anytime you are around us, around the Gambia or in Senegal. Please cross over to see the fruit of your labor, to see what you have cultivated, how far we are going, and we rely on your advice. Finally, I think I have said so much, but we thank everyone and we appreciate your work. Alassane, the board is there for you. We will stay behind you, we will support you, and we will encourage you. Of course, we will be pushing you, so don't be mad when we push you too hard. Thank you very much.
Also recognize and then thank the friends and colleagues who are present here, and we are very blessed, to have you. And I am not following a particular protocol, but I would like to, from the bottom of my heart, thank some brothers and sisters who are here present here. Ndeye Aissatou Njai, my dear sister, it means a lot to me, that you are here. We worked together for many years, in the UN. Coming to the Gambia, not seeing you, would have been not acceptable, simply not. So thanks, dear sister, for being here. So my dear and respected ambassador for the Cheque, when I was joining the Federation in Geneva, my very first day, you were there to welcome me. And I'm also very privileged, when I'm at the end of my term, to find you here in the Gambia and then be blessed, by your presence. My dear brother Omar Sy, and we are, first of all, brothers, and work together at the national and international level to push, the health agenda, together. So it's a very, very great privilege, to have you here. My friends and colleagues, from the UN, Sandra, thank you for being here. Isa too, thank you, as well as, all the other friends and colleagues, that are here. Why I am doing it this way? Because our presence reminds us of something very simple. We are a community of people who care. And that is such a wonderful privilege to be a community of carers, and that is such a privilege to be a community that serve other people. Why? Because we are not any better than the people we serve, but we are just a little bit, more privileged, than them. And if we enjoy, that position to be a servant, then it comes also with a heavy load of responsibility and then commitment and humility to do so. And if we're here also to support, we cannot, have the arrogance to believe that we care about the Gambians more than the Gambians themselves. We don't care about, the Gambians more than their own leaders. We're only here to be on their side, to support them, design and implement their own programs. And that is how our successes, will be measured. I'm very, very glad and happy to be one of those, to be part of that journey, and then to be on the side of those that will be leading the response on a daily basis. And I'm here with all my colleagues from the Federation to show that it is not only an individual personal commitment, but an institutional commitment that will go beyond the people themselves. And no matter who will be in the seat I'm sitting on at any given point in time, the commitment and the support will continue. I'm very proud to be part of your success. And thank you for associating us, to that. And thank you very much for the opportunity to be here.
For the presentation, I would like to invite the president of the Gambia Red Cross Society, Jato S. Silla, to do the presentation. And this is also a painting, but this is more of a Tukuloro village. So it goes to LSC, the Secretary General of the
the sailor village behind them. There's some reason why you should hide them. So the Tukulor village, look at how big it is. Don't drink any more. Thank you.
Thank you very much. This other one, we also go to one of our guests, and it's nobody else but Simon Misiri, the acting head of the regional office in Nairobi for Africa, IFRC. And I would like to invite the Secretary General of the Gambia Red Cross Society to do the presentation.
For sparing all their time to come forward to support this agenda of ours. I think it has been very great of them, and we are really short of words. Mr. C, having such an important agenda all over, having to leave that and to come over to the Gambia to support the Red Cross, I think is something that we really cherish. And we want to say thank you for everything. Thank you to all others who have been here today for this support that we have seen today. I think this is just the beginning of the collaboration, of the togetherness. I think there are many more things that we can do together. After all, this is humanity, and we are doing it for ourselves. And we really want to thank all of you for sparing the time. We thank you so much, and we wish you all the best back home. Thank you very much.
Modu Drame, and I am the Soul Health and UB1 Country Project Manager for the HSSG project, that is Healthcare Support and Strengthening Project.
Can you tell us your expression about the money they have, like what's happening to the health sector and the Gambian people?
Okay, the money was donated by HSSG, that Red Cross is already also part of. And as I said, I'm representing Soul Health, that is an American-based NGO, and then another NGO in Germany called UB1. So it's UB1, Soul Health, and Red Cross that are implementing this project. So the money was donated by these three institutions in a project called HSSG, as I said. So the significance is very great. It all happens at a time when we developing the project proposal, we approach the Minister of Health, and then one of the concerns they raise is the high attrition of C agents, the community health nurses, and then if we can able to help in improving the human workforce, and then we agree. So the money that is handed over to the Minister of Health is to support 45 new C agents for 2 years, and that includes their stipend and their tuition fee. And then if we have the funds, we also want to give them some incentives to motivate them to stay in the regions, because these are people who work in the grassroots, and they attend to all kind of cases. So we feel they should be motivated to stay and to put their best in healthcare services.
When you talk about CNS, or what do you actually mean?
That is community health nurses. You have different cadres of nurses. So these are the community health nurses. Normally they are the village health service, and then they are the first point of call. Like when someone is sick, they are the first people that attend to this person before the individual is taken to the health facility. So these are the people that we feel are very important, and they need to have the required skills in order to provide professional services and efficient services like we have seen in other countries. In the 70s, I understand, was very robust, but along the line, there was shift. People were paying more attention to secondary and tertiary health institutions. And now the Ministry of Health even want to revive the primary health care strategy. They want to revitalize it. So the HSSG project is also helping in this and that endeavor. So
when is the project expected to start?
The project was officially launched on the 21st of February. Last year, that is 2018, rather this year, 2019, in Basse. So which means it already started. And then, as Andy Fado said, we have 3 initiatives, and the first initiative is to help in the vitalization of primary health care, that the money is given to the minister for. And then we also want to provide potable water supply, boreholes for that matter, for a number of communities where we did an assessment and we found out that water remains a major public health problem in the rural Gambia. And then, because currently we are in URR and CRR, so we want to provide 30 communities with boreholes. That is what we plan to do. But currently we have funds for 3 communities, and then very soon we're going to start that process, and we expect by April that should be handed over to the communities. And also we want to provide VIP latrines, that ventilated improved pit latrines, to about 722 households, according to the data of the assessment we did. Because we found out that there are some households which are still going to do what we call open defecation. They don't have latrines, either because they don't have the money, or because when they build, because of the soil type, the latrine collapsed. So at some point they are fed up to be digging, and then they go back to the traditional way, that is going out into the and we all know the health effect of that practice. So we also want to make Gambia OD free, and then by doing so we have to build latrines for these households. So that is one of the plan of the project. And also we know that NCD is a problem like hypertension and diabetes. So in collaboration with Health Promotion Directorate, if we have the funds, we will make sure that we also tackle or address some of those issues, and plus other maternal and child health issues.
So are you going to concentrate on all the 5 regions in the country?
Yes, important question. The project, like I said, the plan period is 5 years, and we want to do it in phases, 3 phases. So phase 1 is for 2 years, which is URR and CRR. That's where we are. And then I think by the end of this year, that the 2 years will be set. So we plan to move to North Bank and to LRR, and then finally to West Coast region.
Thank you so much.
Thank you.
Apart from the things that you have said, what other things are your plans?
We found out that maternal death is also high. Like I said, this is Gambia registered one of the highest. I think significant gain has been registered, and thanks to Ministry of Health and the partners who have contributed, but it's still unacceptably high. So we want to buy these safe clean delivery kits to antenatals, and we supply them to health facilities for safe delivery. And we also want to conduct what we call behavioral change communication using the Red Cross volunteers. The Red Cross has more than 20,000 volunteers across the country. And we want to use these people to be health educating people at household level and also at the community level. And also we want to buy anti-diabetic and anti-hypertensive drugs, to address the NCD, as I said. But that we're going to do with, in collaboration with the Ministry of Health. So these are all what we plan. But as I say, we don't have funds to implement it. So I think I will seize this opportunity to call on donors, to come to help this very timely, relevant, and laudable initiative.
Thank you so much.
Yeah. All right.
The project is at a tune of $7.4 million if it is fully funded, and it is supposed to help URR, CRR, support them with water and sanitation. Right now we are about to sink boreholes for them. And in each community that we will be working with, we have identified 30 communities, and hopefully by the end of the project, we will be able to give them running water, pipe water, rather than giving them wells. And aside from that, we are also doing health education. We are also looking at non-communicable diseases. We are also looking at strengthening the primary health care through the Ministry of Health. There are a lot within the primary health care system. One is what we have done, and we will also be working with communities in building their health systems, supporting them through the Ministry of Health and the regional health teams.
These 2 million you have mentioned, who is the full donor?
The donor is us, the Gambia Red Cross, the UB1, and the Soul Health, because this is a joint project that we are running, the 3 institutions I talked about.
So how often will you be going to do visits to make sure that the money you have donor will be put into good use?
We have worked with the Ministry of Health before. What we have been doing is we are working through their regional health team and our branch offices. In each region we have a branch. So in CRR and URR we have branch officers and we have volunteers. Some part of the work, if not most of the work, will be done by the volunteers. But this 2.4 is specifically meant for the training of CHNs. We'll be going to them looking at how the training is going on for 2 years. And aside from that, like I said, 7.4 is a big lot of money, and they will be implementing in URR and CRR in the next 2 years. We started last year, April, and we'll be moving. After 2 years, we'll be moving to URA, LRR, and North Bank. So we ourselves are going out in implementing and monitoring the activities. Ministry of Health also is going out to monitor what we are doing, and a lot of other partners.
Are there any challenges?
Yes, there are challenges, because as of now, I talked about 7.4 million, and up till now, we are not yet up to 3 million. So what we are looking for is support from partners to help us help the needy Gambians.
Thank you so much.
Thanks.
Ente tomo Amadou Drameleti mbe do nin Red Cross in kolle be do kola ndebe bundale je kaf me UB1 aning Soul Health olmo bundalte melan ko be jamane ne America e to len Red Cross e blodu nyobul kaje ka sanjululu health jare kende a projero kalnati Gambejang andung abenna miro kono wala mu kaje ko primary health care wala mu jare kenda mimbe duma pour kaje mba akolu falina nyaadi le ka ngaklam tanu sanji jama komanto o mu bundalti mi alanka bambanda bake bari nata manko so dala karola so nyimbu jare kinda fongla do kolet kaje ko ka bunda nyin ka wulindi ko dege so projet do nada ko fanan sen bulo du noje ke makoy andu lafta min kala woto wala mu community health nurses wala mu na docteur ndungul min katara sate wolto pour que e mojama ke karandi isaje se londi timmar ngo sodo karanna sate wolto isenna mol makoy no yo ku fula nyangol lafta min kala wala ka ji seno anin jomi alon ka be mol sila ka sodo ndi molye sa ko milbe santoto yo na kula bango me alon ka lafta min kala wala ka senea sabatendi membe ko fo hadama dum fon la senea anin ala dandangolo yo lafta ka kamol le sing nga ka nga kiskisiro ke komanto and waya tandina ko mol bi jele me alon kan sai kata keneta ko wulo kono do kam mu fennete mi alon ko kenota ka munna ka mula jara ke ndatinya so laftaje la pour kaje wo mbo kenula nyaade so nyine munna planol ti lafta min kala ñing projet do ka fami healthcare support and strengthening mi alon ka be Gambia banko kan kol HSSG
biru watu jumala ngale ñum projet ko ñen start
yo projet do ñing nga bundayele wala nga kulli base ñing sango February karo yo mo jamana raje jare kenda mol na rajele media na raje aning school of CHN school la mol fana na raje ñu nata kuke na wala mu komanta domande nga Cheque di ministre la même minister of health min dara fa million fulani wil keme fulani dala wili lulu pour kaje ko ñin no solo ko men nga fa ñamen ke karandi fo sanje fula so ñi projet to le be la karo kare ka domandi mo mindi le ka fa stapen ani la tusono ñi projet to ba be jokan so ko nga fa ñamen projet to ñi dartal kabirim February ha sansa enten man kodo jama so pour kaje lafta min na ngabe tamande bar sansa enten nga kodo so pour ka kolon boholo di sate sabala mi yalon ko killing abe basse banko kan sade flowing olbe makati banko le kan sansa enten bo datila andung jikita ko jannin kare sababe bandale o mu kudol ta nimbe continuer la fanan na kodo min dangosi so keno bo selambe njibe ni wato tala kama ko bal ka fay ko e nanan e ngambulo du nyodo barin tol nga mol soto ko men red cross volontaire soto min tara fo mo wili mu an gambe jang e be dawda sato sade volontaire bi jele andung yubi wani sol health fanan mu moleti mi yalan ko mebe banko e bandala ani red cross so nyin mu meleti mi yalan ko ya afahamo soto ya capacity soto pour ka nyin projet do tamande bar ko dole wala fanko wala manki so beñu wato tala ka fo mole ko mi yalan ko e lafta kam makoy pour isina se ko do ñu lan kajel te lafta mingela pour wo sekeno
ya sate fo mun keta sate sabat mul yalan ko lafta ke makoy ñun ko wala mun keta kolongate fo wolong a satel to mul yalan ko wallal ba surare ñun ko wala bake
yo nga kiskisiro ke ya tandi ko sate jamale be sulani njela même mu ji senoti bare nataje satewlo le sulata joti nyolade yo nata tenteng ning regional ko milbe siri regional to abol kono governo anala do kulalun sita ngaji be sa nyin satol miyalan ko bebe surare njela sate jimala sulata katambi nyin dolla nata nyin sate sabol tombol nyama bar tonya ne atara nga kodo sodo nyin sate ol be yalan ko ngeji be atara fo sate tan saba e bebe sulani njela le kadum mil bije kolongol le bije damal bije dol bije wole han pompo le sodo bar han pompo doli tinyata le na tamata lo kun kilinga buka tama na man tar tama kay kada kolongol to ka jobi je wonata man to rosa meme ko kono bayo ka dindin courant anin nyaadi mol anin ku ko don mi yalan ko be dendin jiola mi yala man senea wolum
ila kuma kan to ya foko altal alia kuwanyin ku jamale plan kuwanyin to apart from yo kuma kan ol mul fo mun ku sifalel bije mul yalan kal bol fanam parande kan pour ka nyum mol makoy
okay nga kalam dako musu kono mal fanam min ka fatingo to mi yalan gambe ja siada nga kalam ta anana siada nun jarakenda bunda do ko je baka na makor balu fatala da baka war hanbi nga je ko men makoro nyanda kala jele kaje wo tala so lafta musu kono maka sula fengol minna pour nabi ta tingodo pour ko dol sang ka di jara kenda bundala pour isa janjandi loptanol to lata num franka bari yele selo ani sukur kurango fendete mbialan ko benen be siari jang ni sa ko soro ka boro jama sang ka di loptanol la isaje molse munafang anunga volontaire mbialan ko wol benna sade wol to pour ke karandi ibaje la nyil vitale de sate wol sate anin kadum molno mela sol kono ke karandi kurangol le tamansero ani be asute la nyaade ni kurang so de nyanta muneke la pour mol se fahamu wo sun kaje comme docteur ya fala diamo kono kujama mi alan ko gambe ja me mbatande wala mol kuran ka mol aka lokula la jande bitalo jaralo nyine la o mu fahamu balyalde ban ni mol fahamu ta dron e baje lale wo sifalu mobi na taman seroje kadabake asida jaralo nyine saje docteur ol fanan sa kuran nyin kalamino kuran nyin ta sembo solla an kora sakasa amarifa so jin bebe na ferol kono la pour yal mi yal lafta taman la nyin sanjudul projet toto ko nga fa ñamen sanji fula folo lafto kala basse bankol kan anin makati sanji fula njang bo kala bari bu bankol kan anin jara banko kan sanji kilingo min las yati lafto kala kombu ma fa ha
baraka
okay
min fama hani fentuwaye jam am giri roli sol man muka hani fentuwaye jam albeni la ye duwale jal se jabur jam ndol kabi freedom of space te buwale jam duwal be la duwa du buwal be buwa alla bolon esti Gambian dream brikama boyo ndol kanna kuwole ki is all about Gambia.